Hi, I'm Dr. Kolesnikova with Women's Pelvic Surgery. So you just scheduled your surgery for pelvic organ prolapse and you're having a robotic sacrocervical pexy. Let's go over some expectations. During the surgery, 4 small incisions are made in the abdomen. And by inserting a camera and small instruments, we're able to do the surgery minimally invasively. If you have a uterus, during the surgery, we're also performing a partial hysterectomy. Depending on your age, your ovaries may also be removed. Then to actually correct the prolapse, we attach a piece of mesh to the cervix and lift it and connect it to a strong ligament that's on the spine. Some of you may have heard negative things about mesh. The mesh that we're using is different. It goes in a different location, and for that reason, we consider it safe and effective. This surgery, like other major surgeries, has similar risks. These include bleeding, infection, damage to the surrounding organs, which is your bowels or your bladder. Most commonly, these surgeries go fine and there are no complications. And if there are complications, most often they're minor, like a urinary tract infection or an infection of the skin. So you just had surgery. Here's what you can expect when you go home from the hospital. Most of our patients go home either the day of surgery or the next morning. When you're at home, the best way to manage your pain is to take Motrin and Tylenol. You can take the 2 together every 6 hours, or you can stagger them and take them every 3 hours. We also send you a strong pain medication, which is an opioid. If you need it, you take it for breakthrough pain. One of the most common things that patients experience after surgery is constipation. So stay on top of that. Take Kolase starting the day you leave the hospital and just continue it for the next week, unless you're having diarrhea. Most often, patients feel fine after surgery, but reasons to call our office is if you're having fevers, chills, nausea, vomiting, you have redness or drainage coming from your incisions, or your pain is not controlled with the pain medications. Or if you just think something is wrong, feel free to reach out to us. So if you have any further questions, you can set up a consultation with us. Otherwise, we'll see you at your preoperative visit.